A pleasant day to everyone. Thank you for this opportunity to share with you via this virtual presentation my research titled Pandemic Narratives, a Foucauldian Discourse Analysis of Messages Communicating the Non-Pharmaceutical Interventions of COVID-19 Infection and its Transmission. I am Maria Nornelyn Cachuela. I am from De La Salle University, Des Marias, Philippines, and also a student from the University of the Philippines Open University. This day, I would like to share with you the following. So this is the study I conducted based on the pandemic that has happened to us. There's a long story behind it, but the official name came from the longer name of the pandemic is the Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2. Eventually, it was called COVID-19. And was declared as a pandemic by the World Health Organization last March 11, 2020. So consequently, the governments across the globe in response have imposed strict precautionary measures or non-pharmaceutical interventions such as social distancing, lockdowns, and wearing of masks to save and protect the lives of their citizens, of course, until the virus is available or until the virus subsides. So for this study, I looked into the discursive formations, social historical events, and the social cultural practices evident in social media discussions on non-pharmaceutical interventions during the initial stage of the COVID-19 pandemic, March 25 to June 25, 2020. So for the operational framework, I looked into or I referred to the Foucauldian Discourse Analysis Methodological Toolbox by Jagger and Meyer. Specifically, I looked into the discourse strands, the discursive events, the discourse fragments on the NPIs, the discursive formation, and the sociocultural practices that were formed. And then for the more specific methods and procedure, the study employed a critical qualitative research design that is drawn on a critical discourse analysis approach based on the philosophical ideas and theoretical groundwork of Michel Foucault, referred as the Foucauldian discourse analysis. Embedded in the constructivism structuralism tradition, the Foucauldian discourse analysis determined the connections of discourse, social circumstances, and of course the discourse practices. The study was conducted on a countrywide scale as it was based on the post available in the Department of Health's official Facebook page. There were around 465 samplings identified through opportunistic or emergent sampling. So there were three phases for the study. Phase 1 is a structural analysis of the discourse strands. The second phase was the detailed analysis of the typical discourse fragments. And the last phase is the synoptic analysis of phase 1 and phase 2. So for the data or the findings of the study, let's start with the discourse strands that referred to the NPIs. So we can see that stay at home was the initial, and then followed by face mask, and then social distancing, and so on. So non-pharmaceutical interventions such as stay at home, use of face mask, physical or social distancing, hand washing, mask testing, and isolation are the public health standards to mitigate the transmission of COVID-19 to help flatten the curve. So the discourses materialized following emerging issues such as stay-at-home orders and travel restrictions. We have the enhanced community quarantine in the Philippines. There were also issues related to, of course, increasing new infection cases, the need for isolation facilities for infected individuals, policies and guidelines, and enforcement of NPIs, the number of recoveries and deaths, availability of test kits and centers, accuracy and reliability of the test results, the non-compliant behaviors in the communities, safety of frontliners and healthcare workers, limited medical supplies, employment problems, availability of medicine or vaccine, and of course, the distribution of financial assistance from the government. So these are the perceived purposes of non-pharmaceutical interventions. We can see that majority or majority looked into NPIs as preventive strategies. And then the second most responded type of perceived purpose is the detection, and lastly is the treatment. So for each of the purposes, we can see the different insights of the public. So there are compliance, non-compliance. For prevention, there's flattening the curve. For the detection, we can see testing, contact tracing, transparency, and accuracy of the testing kits. For the treatment, however, we can see that the issues were more of cure and non-availability of medicine. So because again, this is the early part of the pandemic. So we have also the following. These are the different variations on non-pharmaceutical interventions. The entanglements or diverse threads of NPIs reveal several possibilities, variations, and layers of observing health protective behaviors. So we can see this from the stay at home, also in wearing a face mask, and social distancing, just to show samples. Now, moving on, we have the response of non-pharmaceutical interventions as preventive strategy. As mentioned earlier, the data is very consistent in terms of compliance, support, and questioning for some. So the overall ideological position of the Filipino public towards NPIs include cognitions on appeal for compliance, adherence, support, and cooperation. We can also see how the public in phase two detail presented their discourse or presented their points and views on the non-pharmaceutical intervention. So many have expressed it directly. Some use non-verbal cues such as ellipses, emojis, and words such as stay at home, please, asking those who are not complying to really comply and observe the non-pharmaceutical interventions. We also see here the circumstances illustrating the discursive practices. The data revealed existing consistencies and diversities. Half the discourse carried similar notions on adherence, while the remaining discourse dealt with other issues linked to the pandemic, linked to the lockdown or the community quarantines imposed by the government. The discourse fragments also reveal repetitive themes. Okay, and of course, some differences as well. So we can see that the discourse strands demonstrated emotionally charged comments. There's a strong sense of empathy constituted positive sentiments of support and optimism, while the negative claims reveal frustration, disappointment, worries, hopelessness, sarcasm, and anger. So the social cultural practices materials reflects willingness of the public to really support and adhere to the variations of non-pharmaceutical interventions to prevent the risk and of course the transmission of COVID-19. So to conclude, we have identified that the public associates NPIs really with prevention, detection, and treatment. There are ideologies and biases associated with awareness, understanding, support, and compliance. The public is speaking and resonates the continuous production of knowledge, meaning, and practice, which may be attributed due to the novelty of COVID-19 health crisis. Acceptability and willingness is an individual choice and responsibility rather than a collective effort. And the social cultural practices of NPIs differ from one person to another, again influenced by the level of understanding, the different ongoing realities brought about by the pandemic, their own social realities and culture. So the ideological positions and emotional claims create a stream of emerging social-cultural practices that has materialized and continuously shaped provokes and is provoked by the social realities of the COVID-19 pandemic. So to recommend, as a recommendation, let's use pragmatic approach and risk communication. Social mobilization initiatives may bring people and mobilize people in the community. Constant evaluation of risk communication strategies are also very important. And having a crisis communication management center or management team with a command center will also help convert uncertainty and confusion into public trust and compliance. That ends my presentation. Thank you for your time and thank you really for this opportunity. Let's all stay safe.